my name is Allie O'Brien, and I'll be performing a blood smear for the Clinical Lab HOSA competition. Before you even start, make sure that your area has been properly sanitized using a disinfectant spray or an ethanol spray. Next, make sure that you're wearing the proper PPE, which would be a lab coat or a disposable lab gown, face shield and eye protection, which I do not have a face shield, so I will just be using eye protection, and gloves. Before you put your gloves on, make sure that your hands are properly sanitized. You can use either hand sanitizer or wash them at a sink. Then once your hands are clean, you can put your gloves on. Once you're properly prepared, you can start your blood smear. Take 2 microscope slides, or a microscope slide and a cover slip, and look them over for potential chips or defects that might have come from the manufacturing process. These slides look good, so I will be using these 2. Once you've picked your slides, make sure that you grab a sterile alcohol prep pad to clean them off. When they're made in the factory, they often come with bits of dirt and grime, which will not allow them to be a good candidate for a blood smear. It may impact your blood smear, or it may contaminate your sample. So make sure that they are properly cleaned off before you use them. Then just dispose of your alcohol pad. Now I will give them a second to dry before I start my blood smear. Once they are dry, place the slide you will be doing the smear on firmly on the table. The other one will be your spreader slide. Then you will prepare the blood droplet on the slide. This is typically done with an applicator, but I will be using a micropipette set to 10 microliters. When placing your blood sample on the slide, make sure that it is at least 3/4 of an inch from the edge and in the center of the slide. You want to make sure it's roughly 2 millimeters in diameter. Next, with your spreader slide, place it at roughly a 30 to 35 degree angle in front of your blood drop. Then gently back it up until it touches the drop, then move forward in a fast motion, gently arcing it up. This will create a smear on your slide if you've done it correctly. Then, with your cover slip, dispose of it properly in a sharps container. When you've prepared your slide, make sure that you properly label it as to not mix it up with another patient. You can do this with the patient name, ID, and doctor who performed the slide. Then, place your slide off to the side to dry. You cannot touch the slide until the blood has been properly dried first. Once your smear has been complete, make sure that you properly sanitize your area using a disinfectant spray and wiping it down. Then, properly take off your PPE. With your lab coat, if you are not using a disposable one, make sure that you wash it immediately afterwards as to not spread potential germs or pathogens around. Then, make sure that your hands are properly washed. And that is how you perform a proper blood smear.